Welcome and thank you all for joining us today for the Weekend Wellness Hour. And today we have my special guest and friend, Dr. Felecia Froe. We met about a year and a half ago on the Real Estate Guys Summit at Sea cruise, where we were both there for learning about investing, and there was some personal development and we hit it off. And then now we're both in Kyle Wilson's Inner Circle Mastermind. And I must tell you, this lady is funny. She has amazing background. So let me tell you a little bit more about her. So Dr. Froe has been a licensed urological surgeon for over 20 years, and she now consults with people virtually to help them with their health. She's also the owner of Money with Mission, an investment company focused on empowering professional women to build wealth and achieve financial freedom through social impact investing. She has partners with the Eco Alliance Group, where they provide healthy food for food desert areas by means of indoor vertical farms and grocery stores. She's also written many best-selling books, including How to Create Wealth That Outlives You. She's also an advocate for sharing the great work of others and their community through her podcast, Money with Mission Radio. So I want to welcome you guys all. Dr. Felecia Froe, thank you for joining us today.
Hey, everybody.
I'm so excited to talk to you. Is there anything else about your background you'd like to share with us?
First, this is my first Facebook Live, so
Yay.
It's been a struggle to get me here, just so you know. Maybe one thing is that I didn't always want to be a urologist. I didn't even always want to be a doctor. In one of the books I wrote with Kyle, Life-Defining Moments, I think, I talked about how I went to my dad to say, hey, I want to be a veterinarian. My dad's a veterinarian. I want to be a veterinarian. And he said, if you're going to school that long, you're going to be a doctor. And from that moment on, I was going to be a doctor.
That's awesome.
Urology, interesting. We could talk about that. How did I get to urology?
Yeah.
I thought I was going to medical school to be a pediatrician or a geriatrics doctor, one of those two things. And in medical school, you go to regular school and then you start doing rotations with different kinds of populations of people. I love kids. I didn't like the parents of sick children. They were really difficult. And nothing about the kid. It was probably more about me, obviously, not being able to deal with that at that age. So that wasn't for me. Geriatrics and that kind of thing. I learned so much about myself and my wanting to fix things. So those kinds of chronic condition fields of medicine didn't work for me. So urology, surgery, and medicine. So you get to do you mix those things quite a bit. At the time that I chose urology, there were only 100 women in urology in the country.
Oh, wow.
So I like challenges. You know that, Amy.
Yes.
Say I can't, and I will show you different. So that's how I got to here. And I've been actually, when I think back how long I've been in medicine, it's actually a little over 25 years. So
Wow.
I can't believe it.
That's awesome. So then you did your medical school and then you chose a residency, and a lot of times you do multiple residencies, right? Or did you just do one?
I just did
one. How does
one.
that work? Okay, you did one.
People do more than one.
Okay. Wait, I thought we determined you're crazy.
Oh, sorry. Yes, that's right.
Don't worry. You spread it out and now you're in the investment world and have a whole nother business. So that's your crazy.
That's so crazy. Exactly.
Yeah. So did you start right away in a hospital, a private practice? Where did you go after you finished your residency?
Yeah, after residency, I moved to Minnesota, St. Paul, Minnesota, and was in a very large, we call it now fee-for-service practice. I was the only woman in that group. And being the only woman in a particular practice, my practice skewed towards women. It's not how we're taught. In residency, you learn everything. And in urology, one of the least things you learn is about women. Moving there, I had to learn about women and urologic problems very, very quickly. And it became something I truly enjoyed doing.
Interesting. So then from there, like what are some of the topics that you saw? What did you cover? Like, what are all the issues?
Yeah, so back then, okay, it's so weird to say back then, urologists treated many, many women, the majority of women, I think, who had incontinence. And incontinence is you cough and a little bit of urine comes out, or you got to go real bad and urine's coming out before you get to the bathroom. Those kinds of things we would treat. And I felt very good at treating those. Pelvic pain is another thing that urologists treat. And I saw a lot of women with pelvic pain, and they would come with different diagnoses. For example, I saw many women who'd come with recurrent urinary tract infections, is what their doctor sent them with. A urinary tract infection is pretty easy to diagnose. It's a test. There's a test to do to diagnose an infection. It's not just, you don't just have to go by symptoms. And if you never have a positive test for a urinary tract infection, you don't have urinary tract infections. You have pelvic pain, and we address that in a different way than antibiotics. So one of my, as Amy said, I've steered into other things in life, investing. And one of the reasons for that is that traditional Western medicine for me is very patriarchal, and we don't tend to give people information the way I think we should. So it became very difficult for me to stay like I was doing.
Yeah. And then now you do consulting, right? Virtually with people?
No, I still have a practice, and the only reason it's virtual right now is because of COVID.
Okay.
If somebody needs a surgery, you can't do that virtually. You've got to go do it in the hospital. So we still do that. I'm working part-time, so I see much fewer patients, and I'm much more like it, actually.
Wonderful. Okay. So now, do you see men and women both, or are you mostly geared now in your practice towards women?
No, my practice now is actually more men.
Okay.
When I was in my own, I've done multiple different practices. So I was in that practice in Minnesota. Then I moved back to Kansas City after 5 years because it was too cold in St. Paul for me to stay there. That was ridiculous. In Kansas City, I was there for 7 years. And for 5 of those years, I was in a solo practice. And I worked with a group of women, OBGYNs. We had a whole center where we treated just women. And my practice was just women. It was called the Urocare for Women is what it was called. So I treated incontinence and pelvic pain and all those different kinds of things. I actually really did like that practice. The challenge of it, like I was talking about, was medicine. And medicine has become, or at that time to me was a little, conveyor belt. In order to keep up your income, you had to see a whole bunch of people, which didn't give you a lot of time to talk to people and really get to the root of a problem, which is how you and I really have connected, is that you get to the root of a problem to try to fix the problem, not just the symptom.
Absolutely. Yeah. So obviously you deal with urinary tract issues. I imagine you work with the bladder and maybe even the kidneys a little bit as well.
Yeah, so thanks for asking that, because I do often forget that everybody doesn't know what fully incorporates the urinary tract. So urologists deal with kidneys is in relation to kidney surgery. So kidney stones, kidney cancer, those kinds of things. A different kind of kidney specialist, a nephrologist, deals with kidney failure and making sure your kidneys keep working. So urologists do kidneys. There's tubes between the kidneys and the bladder called ureters. There's the bladder. There's the urethra. The urethra is the tube that gets the urine from the bladder to the outside. Women, it's short. Men, it's a little longer. And then we also take care of male genitalia, which includes prostate gland, testicles, penis, all those things urologists take care of. We tend to send women with vaginal issues and those kinds of things to the gynecologist, and they take care of that.
Okay.
I'm saying words on Facebook Live that you know.
I know. And you know what? We all have these body parts, but we often don't hear anyone say these words. And
Not
it's like,
the real words.
No, I know, but they're very important. And trust me, whenever we have a problem with these areas, we run to a doctor to try to help us, because you can't survive long with problems in these areas.
In those areas. And people often say, it's in my area. And then you have to get I need you to get a little more specific on that one for me.
Yeah, there's a lot in the nether region. So yeah. So this is maybe a little bit TMI for people, but my dad recently has been diagnosed with kidney disease. And so he has also had issues with his prostate. Sorry, Dad, I'm just putting this on the air. But so, I've become a little bit more familiar with talking to him about his urologist and his nephrologist. And so I know these are big concerns for people because it really affects your life. Can you just go through with the urinary tracts? Can you just talk to us about how blood is filtered and it produces urine? Because this is really important, because I know that he had a lot of questions about why are his legs swelling? Everything else is fine. And then that was the one big thing, that his legs are swelling. So can you just talk to us a little bit about that?
Absolutely. So first of all, when you go to a specialist, they look at the part of the body they specialize in. And often even the doctor doesn't put it all together. So your urinary tract is a part of your overall body, which gets blood from the same blood that goes to your urinary tract, goes to your heart, goes to your arms, goes to your brain. It's all the same blood. So we can't really doing a good job separate it all out. So just to take your dad as the example, and his legs are swelling. So I have to start thinking, is that a heart problem or is that a kidney problem? Swelling is due to fluid collecting in the tissue that doesn't stay in the blood vessel. It could be a heart problem if the heart's not pumping well. It could be a kidney problem because the blood that's getting to the kidneys is not being filtered through areas called nephrons, so that all the appropriate stuff is being removed from them. So that's getting more into nephrology, first of all. So if some nephrologist is listening, oh, she don't know what she's talking about. You're right.
Yeah.
So kidneys filter, just like the liver filters, kidney filters. And when the kidneys are not functioning well, things that are supposed to leave your body, stay in your body, include water and other chemicals that are in your body that should be leaving, can stay there and cause a lot of different dysfunctions of your body.
Yeah.
That help that? So
yep. Yeah, so I know that's kind of, it's hard for when, you see that you have the swelling, it's like, okay, it can be your kidneys too, and learning how important it is to take care of our kidneys. And so I just wanted to bring that up so people understand that whole system.
Yeah, and it's hard to take care of one particular part of your body without taking care of your whole body.
Yeah.
So that's really key. It's like people ask me, how do I keep my kidneys healthy? How do I keep from getting prostate cancer? How do I keep from, it's like, well, that low fat, high fiber diet that you're supposed to eat, more plants than meat in your diet, that's all important in keeping your overall body healthy, including your urinary tract.
Yeah, so one of the things that I was hoping we would talk about is diet and nutrition, because from stuff I've been reading, high protein, animal protein diets can be hard for our body to process and filter. And so that can eventually lead to problems with the kidneys. But also we've heard these things about if you have a urinary tract infection, you eat cranberries and that helps. And so I'm curious what your thoughts are on like certain things like that.
So cranberry sugar, the sugar of cranberry called D-mannose, is the part of a cranberry that can help prevent a urinary tract infection.
Got it. Okay.
However, people want to take something to get better.
Yeah.
And most of the time when somebody says, I get a lot of infections, it's like, how much water do you drink? It's not necessarily a pill you need to take. You need to drink more water. Or actually what happens is people come and say, women particularly come and say, I get an infection, so my doctor told me I need to go to the bathroom every 2 hours. I'm like, that's great. Do you have to go to the bathroom every 2 hours? Do you feel like you need to go to the bathroom every 2 hours? No. Well, then that's not a waste of time. You need to drink enough water so that you feel like you need to go to the bathroom a reasonable amount of times. Every 2 hours is actually probably a lot. It depends on the person, but it kind of depends on you. If you just go out and squeeze out a couple drops because that's what somebody told you to do, infections that happen after sex. A lot of women say, I get up every time after sex and go to the bathroom. I was like, do you have to go to the bathroom? No, but I was told I should go. Do you feel like you need to go? No. I was like, well, that's probably true unless you're marathon sex. You usually pee before you go. And then by the time it's over, you don't got to pee again. So instead of, sorry, you guys, I said pee.
Hey, go with it. Just go with it.
This is how I talk.
It's all good.
In my
it's
office,
good.
You know how I talk. Instead of thinking I got to get up and go to the bathroom, I got to get up and go pee, think I got to get up and drink I need to drink enough fluid so that sometime in the night or sometime within the next 4 hours, I'm going to the bathroom a good amount of urine so that any bacteria that had a chance to get in there, they're washing out like it's Niagara Falls. Niagara Falls is pushing them all out. So it's, to me, our bodies, this is not to me, but our bodies are majority water. And water is the key to everything. And once you're drinking enough water and you're still having a problem, then we have to address it in a different way. And that's not just the urinary tract, that's headaches, it's a lot of things.
Yeah. That's interesting. So kind of one of the biggest takeaways then is to really improve your health, including your urinary tract system or your urinary system, is drinking more water, making sure you're hydrated.
Correct.
And I'm curious then, so people who have kind of incontinence or who have like a spastic bladder where it doesn't really want to release urine, do people who don't void completely, does that lead them to be more at risk for an infection?
So I'm going to clarify something. A spastic bladder is something different in my mind than I think where you got.
Right.
Okay, so if you do not empty your bladder well, it could be due to a lot of things. And it's usually not a bladder. It could be a bladder problem, but if it's a bladder problem, it's because your bladder does not have tone. It's not because it's spastic, it's because it cannot contract and squeeze like it needs to.
Got it.
If that's not your problem, and that usually can come with multiple sclerosis, the bladders can behave that way. They can behave that way from different spinal cord injuries. Multiple sclerosis is a little weird because it can do a couple different things to your bladder, completely opposite. Mm-hmm. But spinal cord injuries in different areas of the spinal cord can cause the bladder to be what's called atonic. It has no tone and it just fills up. And the way we sometimes find it is that people are incontinent and we find out they're incontinent because their bladder's never emptying. It's like they put a pitcher under the faucet and just filled it up and now it just overflows. So they're
Got it.
The other reason people become incontinent is more about their pelvic floor. And if your pelvic floor, so if you think about a bladder and the urethra sticks off here, the pelvic floor is what holds the urethra, can tighten it up. So if you cough, it tightens to keep urine from leaking out. If you have to go to the bathroom and your bladder's contracting, and your pelvic floor can't tighten up enough to keep the urine from coming out, you're gonna wet yourself. So the cough leakage is called stress incontinence. It's a stress pressure. The leakage, because your bladder's contracting, and the muscle can't tighten up, is urge incontinence, but they're the same thing, a muscle problem.
Got it.
So, and then a lot of different problems can be with the muscle. It could be, some people say, well, my muscle's not strong enough. And some people I examine and you do a Kegel contraction, finger in the vagina, squeeze my finger. If it's a guy, finger in the rectum, squeeze my finger. And you can, what people are squeezing is amazing sometimes. They're like, I look at them, it's like, are you doing it? Yeah, I'm doing it. And I look at them, their eyes are tight, their hands are squeezed, their stomach is tightened up, and nothing is happening in their perineum.
Oh,
nothing.
Wow.
We make an assumption that everybody knows what that is. But who taught you? Who taught you that? Nobody.
So I know there's pelvic floor physical therapists or providers. Do you send people to that, or do you give them a few exercises for them to practice themselves?
It depends.
Okay.
Sorry, go ahead. It depends. Yeah. If it's that person who couldn't squeeze their pelvic floor to save their life, then they go to physical therapy to learn how to do that. So if it's a person who's got it, like, oh yeah, you got this, then here's the exercise.
Got it.
And I tell them it's going to take 3 months. Don't expect this to be 100% tomorrow. Just like my trainer at the gym says, I'm like, how come my abs aren't strong? I'm like, are you doing your exercise? Yes. Okay, well, it's been 3 days, so give it some more time. It definitely takes time.
Yeah. Yeah. So that's good. And then while people are doing, like, let's say they're retraining their pelvic floor muscles, do you have them do anything else specific in terms of diet or regulating their water intake? Anything else? Do you get them on a schedule or anything like that, or just kind of let them go?
Great questions. I mean, it depends. It depends on what their overall problems are. So if I have somebody who comes in with urge incontinence and frequency, So this one thing I remember when I had my second child, I was back at work and I was, you just pushed out a baby and you're having a little bit of trouble controlling things. And I realized I was going to the bathroom. Every time I got the urge to go to the bathroom, I'd go. And I was going to the bathroom a lot. And I'm like, what the heck is this? Oh, I don't want to wet my pants, so I keep running in the bathroom. Well, that could get worse and worse and worse if you don't notice what's happening. And so I had to start working my pelvic floor. So if I have a woman who's been doing that for years, we have to do a little bit of training. So first she's got to learn how to strengthen her pelvic floor. She has to learn how to not panic when that sensation comes on, because that's the thing that happens. I've got to go and you just start running, which doesn't help you that much. And so you sit down, contract, do your Kegel contractions. When you feel that when the urge to go goes away, you get up and go to the bathroom like a normal person and not running and doing the pee-pee dance as you're on your way. It's not easy. It's easy to say, it's not easy to do, but it is possible to get it done.
Yeah. So are there specific urinary system issues that we have for younger people versus older people, or do you see similar stuff?
I can see similar things in both. When I see a younger woman, 30s, 40s, we're kind of talk younger, and sometimes even younger in their 20s, especially a woman who's had some pelvic trauma. And pelvic trauma includes easy things like urinary tract infections. If you've had a lot of infections in your life, if you've had a baby, that's pelvic trauma. There's some what we call iatrogenic things, and that's something caused by a doctor. Some things doctors can do are traumatic to people. And then we start thinking about the traumas like being raped and just different things that can cause specific muscle memory. Muscles are then dysfunctional. And people come, a lot of those women have pelvic pain, and you get into that history. Those are that's the kind of conversation that takes a long time. She's come in there, she's been dealing with this for years and years and years, and she's been told she has recurrent infection. She's been told she's got all these different diagnoses, and there's a lot of frustration in general, but it can be an hour appointment trying to get to the base of the problem. And sometimes it takes more than one appointment, because depending on how open you are about what's been going on in your life and what's happened. So let's say we got to the point, it's a traumatic delivery, something like that. And she had that urge incontinence and that running around trying to get to the bathroom, and she just learned how to tighten up her muscles all the time. Now, let me say this. I've seen more people so a lot of times you're told to do your Kegel contractions when you're going to the bathroom. Not a good time. You're going to the bathroom, it's a relaxation process, which a lot of people don't understand. When you go to the bathroom to urinate, it is a relaxation. You just relax things and it comes out. Many of us go in there and push, and pushing actually causes the urethra, the pelvic floor muscle, to tighten, which makes you have to push harder to get the urine to come out. That causes a pelvic floor muscle dysfunction, so it's tightening when it should be relaxing. And over time, that can become painful, number one, or number two, it can be dysfunctional so that when you cough, it's got nowhere to go. It can't tighten up anymore, so now you're coughing and you're leaking. And I tell you, it's not a weak muscle, it's a too tight muscle, which is it takes a while to figure that out and understand that. And you talk about this a lot. Your muscles are not doing what they're supposed to do. It needs to be relaxed so that when you need it, it can kick in. So that one's even a little bit harder to treat. And I don't know if you got everybody probably knows about your breathing.
I think most people do. Yeah. I think
would be amazing. And I remember meeting you. I was like, oh, if I only had known about this when I was treating all these women. Physical therapists are amazing, amazing, amazing people. They treated so many people, didn't have to have surgery, didn't have to be on medication, learning how to use their muscles better.
Yeah. And it really makes a difference. I know when you're talking about these issues, I'm in the running community, and I hear a lot of runners say that after the years of running, then they start to have incontinence issues. Mm-hmm. And so just thinking about the whole relaxation contraction process when they're running and being able to relax and go in the bathroom, I imagine, while you're running, there is a process of part of you needs to relax to be able to run, but you also want to be able to hold your bladder as well. So Did you ever see runners when you were?
I did. And I can think of one in particular, and she didn't want to work to make it stop. She wanted to keep running and wanted it to stop, so she ended up having a surgery for that.
Okay.
You know, people make their choices. It's like, you know, it's like, I just want it done right now. And I can understand that too. But I think what I'm imagining is that you're running and your pelvic floor has to stay tight, because otherwise you'd be wetting yourself, and you constantly make urine, guys. It's all the time. Urine is being made. So if urine's being made and put down there, your pelvic floor muscles have to be tight to keep urine from coming out, especially if you're doing some high impact thing, jumping on a trampoline, running, doing a marathon or sprint or whatever kind of running that puts a lot of pressure on your pelvic floor. It's got to do. So they probably end stopping to go to the bathroom. You're trying to hurry up and get out of the bathroom so you can get back in the race. There's no relaxing happening there. It's not. It's just like, let it get out. Hurry up. Let's go.
Yep. That's exactly it.
That process over years will get you there. Yep.
Yeah, I can imagine. The other thing that I was going to ask you, when you mentioned chronic urinary tract infections, when you see a client or a patient who has that, has there been kind of like a pattern, something in their habits that have led to this being chronic? Are there any common habits that people have that lead to a chronic urinary tract infection or a repeated one?
Okay, thank you, because I was going to clarify. Chronic is something that goes on and on and on. Usually urinary tract infections go away.
Okay.
And so it's a recurrent or a relapse. So, and sometimes that's hard to figure out. So if I see somebody who says, I have an infection all the time, and there's no getting out, you're like, I have it all the time. Okay, cool. Let's check your urine. And the test is a culture. A urine culture grows the bacteria and will tell you what antibiotic that bacteria is sensitive to. That takes 2 days. So we may start a treatment guessing, and we might be right, we may be wrong. So you might have to change. So anyway, we've got that culture back and put you on antibiotics. As soon as you're finished those antibiotics, let's get your urine checked and see if those bacteria are gone. Okay, so now I can prove to you your bacteria do go away. Your infection goes away. It comes back, and it may be with the very exact same bacteria, which usually it's not. The next bacteria usually is maybe the same name. E. coli, by the way, is the most common bacteria to cause a urinary tract infection, and it is E. coli from your own body. Don't get scared about E. coli from Chipotle or
a salad.
Lettuce from somewhere. Exactly. This is your E. coli, lives right back there on your anus and rectum that gets into your urinary tract. Okay. So we can tell if it's the exact same bacteria because it'll have the same antibiotic sensitivity profile, or if it's different, the antibiotics, it went away and now there's another one that's now resistant to that antibiotic. So once you get an infection, you're at risk to get another infection. If you get another one, you're at risk to get another one. It just can become this kind of cyclical thing. Traditionally, the way we treat that is to put you on a prophylactic antibiotic for a period of time, usually 3 months, try to break that cycle, give your bladder a chance to heal so it can come back to its usual state of health. And then you'll go back to one infection every year, twice a year, or something like that. But 4 infections a year, I'm usually not going to make that better. As bad as it is, I'm usually not going to make that better. If your infections come after intercourse, what I'm going to try to do is supposed to put you on antibiotic long term is get you up and drink water after intercourse and go to the bathroom really frequently for the next 24 hours. There's been some studies that show that women who have intercourse more than 3 times a week and who get infections they're going to be pretty hard to treat and get rid of those. So keep it at 3 times a week, ladies, and you'll be good.
Good advice. See, you don't know this stuff until you talk to someone who specializes in it.
Some of us are trying to get up to 3 times a week, but we don't talk about it. That's another conversation.
We can have that another time. Okay, wonderful. So what are some other common things that you treat? So you mentioned prostate, right?
We did. Yes, we did. So everybody thinks because when a guy has a problem with urination, and actually I see guys at all ages, from I saw last week a 38-year-old guy who's been diagnosed with a prostate problem. You know, prostate enlargement is generally an elderly man's thing, and we're going to say 60s, 70s, 80s. But even then, it may not be. Men have a pelvic floor just like women do. In addition, they have a prostate, so we always tend to think it's a prostate. So there's difficulty urinating, which could be a prostate problem, could be a bladder problem, could be a pelvic floor problem. There's prostate cancer, so that's a different, you treat that, manage and treat that a different way, diagnose that differently. Men have bladder infections too, not as commonly as women. So we take care of prostates in men, we take care of testicles. So testicle cancer is a real thing. We do vasectomies, so that if you're done with kids, we do that. And erectile dysfunction is another thing that guys come to us quite frequently with. And that can be a little tricky because, you know, there's all the advertisements of drugs on TV, and I don't even remember when that started. I know it wasn't there when I first went into medicine, but medications being advertised on TV get people into the doctor's office because they need that medicine.
Yeah.
And WebMD and Google doesn't help doctors either in a lot of ways. And actually, that's not true. It can help. It's more how that person who comes in has looked at it. As many come in saying, this is what I have, as opposed to, what do you think? Could this be it? So it's just the way you approach that thing, as opposed to diagnosing yourself and knowing that's what it is, because that's hard to get out of people's head. You have to kind of convince, you have to go backwards to get forward to where you need to go.
Yeah. Do you see men come in that say they have erectile dysfunction, but it's not really that, and it's something else involving their urinary system that needs to be addressed?
No, usually if they have erectile dysfunction, you get to the questions of, you know, what does that mean to you? It's like either I can't get an erection at all, my erection goes away too fast, my erection's not as hard as I want it to be. Those are the kinds, usually not another urinary tract problem.
Okay.
Except there's sometimes guys may say it's an erection problem and you really get into it and it's premature ejaculation, which is a whole nother thing. And then sometimes guys, as they get older, don't have fluid. So there's no ejaculate.
Okay.
And let me clarify something. Orgasm and ejaculation are two separate neurological events. So your nervous systems, two different nervous systems, the sympathetic and parasympathetic nervous system, it's all one body, but they're two different systems. But those are separate. So you can have an orgasm without having ejaculation. And many guys came in and like, I didn't know that. Yes, you can. And you can ejaculate and not have an orgasm.
Wow.
Don't get sad. That can happen.
I didn't know this either. And well, I'm not a guy, but this is still fascinating. I didn't know this.
It's usually a neurologic problem if you ejaculate and don't have an orgasm. So spinal cord injured patients who want to have children, we can get ejaculation for them doing some special things. So no orgasm happening there. So when a guy finally can get into his head that he can feel the sensation of an orgasm without having fluid, then we can joke around about it. It's like, look, you don't have wet sheets anymore. Look, life is so much better. Your wife is so much happier. Your girlfriend, they can like move on with that. So that's a different thing than can't get it up, doesn't stay hard long enough, or what's the other one? It doesn't stay hard long enough. Yeah. So those things are blood flow issues. So erections are all about blood flow. Blood flow is all about arteries and veins. Arteries and veins are muscular. So they're not muscles you can control, but they are controlled by your sympathetic and parasympathetic nervous systems. So that's where Dr. Amy comes in again. So we talk, guys think erections are just about their penis, and it's not. Your whole body's involved in that, and there's so many different things that could be going wrong that a lot of things has to be looked at, not just physical.
That's interesting because I've often wondered, and many guys have asked me that if they learn to calm down, would that help them? Now, I haven't studied this enough with many guys to actually know, but we know that, as people age, it's a matter of their stressors layer on top of each other, and they just get this abnormal tone, and their nervous system is just in fight or flight mode. So I've always been curious that if we can calm that down, get them more into relaxation mode through breathing, other means, can it help them with erectile dysfunction? So
I would think so.
Okay.
And the guys are going to go, I've been this way. You know, I can just hear a guy saying this. I mean, last year I didn't have this, or the year before I didn't have that. And it's like people say at 50, I fell apart. And I'm like, no, you were falling apart all along. You just started noticing at 50 because your body cannot compensate for that anymore. And so our bodies are amazing and compensatory. They can do so many things when things are going wrong, and then it can't. And now you notice the problem, but it's been coming on for a long time. So I 100% think that if, you know, these guys that have been in this fight and flight, now think about this, guys, if you're scared, you don't even feel it, but your body is in that motion, erection's the last thing it's going to do, because that's going to slow you down. So thinking about having to, or learning how to take some of that stress down, that sympathetic nervous system, turn it off a little bit. It's some work. It's not as easy as a pill, but it's a lot more natural than a pill. I'm telling you, popping a Viagra does not get you an erection, not in and of itself. You have to do some other stuff with that. And there's a whole timing. Nothing is as natural as nature.
Yeah. and as beneficial for you as nature too.
Exactly. Everything, every chemical you put in your, people talk about chemotherapy like it's just for cancer, but chemotherapy is any pill you put in your body is a chemical. If you think about it that way, you may stop putting so many pills into your body.
That's true. Now I want to kind of segue into prostate a little bit, because I know just a little bit, and I imagine you know a lot more, and it would be great to talk about that as much, because I hear people say they have an enlarged prostate, or they have prostate cancer, or their PSA levels are up. So I hear those three things quite a bit.
Okay.
Now, they also say that I've also seen where they'll label it as prostate cancer just because their PSA levels are up. So can you kind of dive into those topics a little bit and educate us?
Yeah, so a PSA stands for prostate-specific antigen, and that's a chemical made by prostate tissue. And when it's made you can measure it in the blood. And made in excess can be an indication of prostate cancer. It can also be an indication of an enlarged prostate. It could be an indication of a prostate infection. It can be an indication of you just ejaculated the day before. All of those things will increase your PSA. Sitting on a bicycle, having a bicycle seat pushing up into your perineum could increase your PSA. So just because your PSA is high doesn't mean you have prostate cancer. In my practice, for guys who come in with one elevated PSA, I was like, let's get another one just to see a trend. PSA is not a perfect test, which most guys who come in and I tell them they need a prostate biopsy, they want all these other tests that can be done first before they have a biopsy. But any test that you follow a trend is a good test to me. If the trend continues to be higher than normal, you're like, okay, well, you should have a prostate biopsy to check for prostate cancer. Prostate biopsy is the only test that can diagnose prostate cancer. There are MRIs, there's all these other tests that can be done, but the only way to diagnose prostate cancer is with a biopsy, and the pathologist looks at that tissue under the microscope to say, yes, it's cancer, or no, it's not cancer. So can you have an elevated PSA and not have prostate cancer? Yes, you can. Can you have a low PSA or a normal PSA and have prostate cancer? Yes, you can. Can you have prostate cancer and it's not going to kill you? Absolutely, 100% that can be true. So we even have guys with prostate cancers, low-grade prostate cancers, that we do not treat. We follow that and just kind of see how it goes, make sure it's not going to get worse.
So there are different kinds, just like in any body part, there's different aggressiveness for prostate cancers as well. So some are slow growing, some are a little bit faster. Is that correct?
The majority are slow growing. So well, let me put it this way. The older you are when you're diagnosed with prostate cancer, the less likely it will affect the quality or length of your life.
Okay.
So a 40-year-old man with prostate cancer is a completely different prostate cancer than a 70-year-old guy with prostate cancer.
Got it.
Okay. And there can be a family linkage to prostate cancer. If somebody in your family got prostate cancer under the age of 60, you're at higher risk to get prostate cancer. So you should start your screening a little earlier. Generally recommend screening starting at age 50. If someone in your family had prostate cancer at age 60, your screening should start at age 40. And Black men are at a little higher risk for prostate cancer, so we tend to start that screening at age 40.
Okay. Okay. And then an enlarged prostate, is that a result of something related to diet or genetics? Do we know?
No, we don't. It's generally aging, and
Okay.
but a lot of things are called enlarged prostate. So so I have guys come in and they say, my doctor told me I had enlarged prostate. It's like, how did your doctor figure that out? Well, they did an exam. And the exam is a finger in the rectum, and that's how we examine the prostate. But to be honest, that exam is mostly to tell if the prostate gland texture is normal. So that's more a test that if there's an abnormality there, you can diagnose prostate cancer and tell who needs to go further testing for prostate cancer. So either a PSA or a rectal exam. PSA is a little better. Feeling the prostate from the outside. So, okay, so here the urethra, this is a urethra. The hole in the middle is the urethra. This is the prostate around the urethra. And to feel the prostate from the outside, I'm trying to tell how big the hole is from the outside. So if you think of it as a donut and you can't see the middle hole, you're trying to tell how big the hole of the donut is by feeling the outside of the donut. You
Ooh.
can't do that.
Yeah.
You can't know. So this could be a big old thick donut with a teeny tiny hole, or it could be a big old thick donut with a big giant hole. So enlarged prostate is more of a symptom thing than a physical exam thing.
Got it. Okay.
That makes sense?
Yeah, totally makes sense. So that's fascinating. Are there other ways that our urinary system degrades over time?
Yes. Over time, just like collagen in our face and collagen in other places of our body gets less because our skin starts to sag. And I think actually the collagen in your bladder increases, making the bladder less compliant. And by that I mean it does not hold as much urine, so it doesn't stretch as well. That's what it means. And that it doesn't happen to everybody, but it can happen. And then it's an aging process. So it's like, that's how you are. Maybe medication can help. I don't know that there's a diet or anything like that that fixes that problem.
Okay, and so you would see that as you just have to go more frequently?
Yeah.
Okay.
Yes.
Okay. And so then are there other bladder dysfunctions that you see? So you mentioned bladder infection, which is more common, you said, in females?
Correct.
And so is that related to a urinary tract infection? Because those are separate issues, but does a urinary tract infection lead to a bladder infection, right? Or how does that happen?
A urinary tract infection and bladder infection. Urinary tract is non-specific.
Okay.
So if you tell me you have a urinary tract infection and I'm getting real harsh, really hardcore, I was like, well, was it your kidneys or was it your bladder?
Got it.
Because that's your urinary tract. If you say I had a bladder infection, that's very specific. That's a bladder infection.
Okay.
That makes sense. So usually when somebody's saying a urinary tract infection, they're saying a bladder infection, but not always. You have to be more specific. Kidney infections generally have more symptoms. Bladder infections, frequent urination, urgent urination, burns when I go. Those are the usual symptoms of a bladder infection. Kidney infection may not have those lower urinary tract symptoms. So if your doctor says your lower urinary tract, they mean your bladder. Upper urinary tract is the kidneys. And for a kidney infection, pain in the back can be one symptom. Fever is usually going to be a symptom of a kidney infection. And people are just sicker with kidney infections. And bladder infections are annoying. Kidney infections can make you sick.
Okay. And then do you also deal with kidney stones as well?
Yep. Yes, we do. And I was just thinking about kidney stones related to infections. Kidney stones don't cause infections. Infections don't cause kidney stones, but a kidney stone that's blocking your system. So a kidney stone that's in the tube between the kidney and the bladder. I'm going to back up. If you think about the kidney as two different parts, the kidney meat, the tissue of the kidney that actually makes the urine, then there's the collecting system that collects the urine and drips it down to the bladder. Once your urine is in your bladder, it does not go back into your body. It stays in your bladder and it goes out. The only way for it to go is out. It doesn't get reabsorbed. So like people come up with all different kinds of things, but once your urine is in your bladder or out of your kidney tissue, it's out of your body essentially. Yes, it's still inside, but it's not getting back in. Okay. Where was I going with that? Okay. Kidney stones form in the collecting system.
Okay.
many things make you form kidney stones. There's not usually one specific thing. So you can say you've got a kidney stone, it's dropped between your kidney and your bladder, and it usually cause enough pain that you sometimes think you're about to die. Specifically women who've had kidney stones and babies say kidney stones way worse than having a baby. Oh. Guys that have had kidney stones, their wives say, now you know what it feels like to have a baby. So it's some pain. My brother-in-law, Marine, tough guy, had a kidney stone, calling an ambulance. He thought it was bad. I mean, we didn't know what it was, and you don't know what it is if you've never had them. You just don't know what it is. Yeah. Something horrible's going on. So most kidney stones pass on their own. If you guys hear noise, that's my dog. Most kidney stones will pass on their own. People want to know, how long is it going to take for it to pass? It depends. We don't know. So where I'm going to go with that. I tell people the secret to passing a stone, if you got one, is fluid, pain control, and gravity. So a lot of when you don't feel good, you want to lay down, get up, drink some water and walk around. If you can't do it, then you need to have surgery to remove your stone, and there's lots of different ways to take care of that.
Okay. What are there any other common conditions or surgeries or anything that you deal with that would be a benefit for us to know a little bit about?
I'm going to go back to kidney stones again, because kidney stone prevention, when people talk about, well, how do I keep this from happening to me ever again? Yeah. And they want to say, what do I need to eat? Do I stop eating cheese? Because the majority of stones are calcium oxalate. And no, don't stop eating cheese. Don't stop taking your calcium supplement. Don't stop drinking milk or ice cream or any of those things. We started this at the beginning. I'm going to say it again, drink more water. It is concentrated urine. All the stuff that's in your urine, if it's not enough water in there, gets together, forms a stone. There's more to it than that, but if you just think about that, you had more water in your urine, you'd be less likely to form a stone. Once you form a stone, you have a 50 to 70% chance of forming another stone in the next 3 years. Okay. So how can you tell if you're drinking enough? People always want to know, how much do I have to drink? How much do I need to drink? So can give you 2 answers. I recommend half your body weight in ounces. So if you're 200 pounds, 100 ounces a day. But if you work outside and you sweat a lot, and that may not be enough. So one easy way, biofeedback, is look at your urine. If it looks dark yellow, and think about it, most people pee in a toilet and there's water in there. So now you're looking at this urine that's already diluted with water and it's still dark, you're way behind. Go catch up. And you want to drink non-alcoholic, non-caffeinated beverages to help improve your hydration. Alcohol dehydrates you over time. So you think about, I drink a beer, I pee, and it's clearer than anything. Yes, it is. But tomorrow, you'll have a hard time catching up. So coffee, people want to drink their coffee. It's like, you don't have to stop drinking coffee. Drink your coffee. Drink 2 glasses of water afterwards. And soon they'll be running to the bathroom so much, like, God dang, I stopped drinking the coffee. I don't want to form another stone. Or, I'll treat you and treat your stones. So water, again, is one of the most important things. I'm sorry, Amy.
Oh, no, that's good. So when you look at your toilet bowl, should it be like that light yellow clear, or is clear too hydrated?
No, clear is not too hydrated. I tell people it would be great if the only way you could tell you went to the bathroom is that there's toilet paper in there. Or the guys, if you could not hit the seat and nobody could know you went, you don't have to flush the toilet, and we save water. It'd be great.
Awesome. Good marker there. Good little plug for all of us women who have men in our lives. Awesome. Anything else that you would like to add to educate us? Because this has been great.
Thanks. It's been fun, actually. Let's see. My biggest thing is water. It is really important. If you want to drink cranberry juice, drink cranberry juice. That if that's helping you, and if it helps you, do it. That won't hurt you. Yeah. Guys, people often ask about different kinds of herbal supplements. Marshmallow root, this came to the top of my mind. I'm trying to think of some other ones. Can you think of any? Some of those anti-inflammatory things that people take. If you have bladder symptoms and it's not an infection, so first check for infection. If it's not an infection, absolutely take those things and keep drinking your water. Okay. D-mannose, you can either drink cranberry juice, but commercial cranberry juice, Ocean Spray, those kinds of not very much cranberry juice in there. So you want to go and spend some money and get 100% cranberry juice, or you can get the D-mannose powder, mix it in water. So you're accomplishing two things, getting the D-mannose sugar and water. And how that, the D-mannose works, it keeps, bacteria has a harder time sticking to tissue with that.
Got it. Got it. Okay. That's wonderful. That's great. Can people reach you if they want to?
Yes.
How can they do that?
About medicine, let's see, thinking what's the best way for medical things. Just go to Felecia Froe MD@gmail.com. Just send me an email.
Okay.
Okay.
Okay. Wonderful. Felecia Froe MD@gmail.com. Okay. Just want to make sure I have that correct.
Yeah.
So we appreciate that. And obviously you also have the podcast for investing and helping women. So why don't you tell us a few minutes, just a couple minutes on that. So you jumped into that to help people?
Often people wonder, it's like, how did you go from being a doctor to being investing? It's like, that doesn't seem to go together. But when I was realizing I wasn't happy with medicine, the way medicine was going, I tried to figure out, and I actually learned this from my daughter, what translates and what about medicine don't I like, and how can I use that somewhere else? So I learned about real estate investing just in a lot of different ways. And then I like helping people. And in medicine, what I didn't like was people didn't take responsibility for their things. In investing, people sometimes don't, but it's a little easier to get them to understand how they must take responsibility. So, and I'm not confined in the times like I have with medicine. So translate it to, I really like talking to people. I really like building relationships with people. I really like talking about money, and I really like talking about how money can help other people, including myself and whoever I'm talking to. So that's how Money with Mission was born. All my life, I've worked with women. Women are, it's like, there's so many things about women that's just amazing to me. It's like, I love you guys too. Please don't get me wrong. I really do. It is just kind of more of a communication style and how we think. So just like guys want to be with guys because you can think that you like each other, we need you guys to help us too. Just in this particular thing, I work with women to help women get past some of the things that are holding them back from their investing and taking responsibility for their financial futures.
Yeah, and I think that's important because sometimes kind of the traditional mold is you get married and you let the guy handle the finances. And so it's nice to have people like you who are pushing women, take some responsibility, learn how to do this on your own, have your own set of investment goals, financial goals. So I really appreciate you doing that as well. So I thank you so much from the bottom of my heart for coming on and talking about this amazing topic, and completely awkward, completely unusual, but it's very needed. So thank you so much.
So welcome. And I start talking to guys on the phone, usually guys on the phone who are talking, this is so awkward. And you're like, we're gonna have to really get into it. So let's just talk. Let's just and call it what you need to call it. You don't have to come in using the correct anatomic word for everything. Call it what you call it. We know what it is.
Yeah. So it's great. And I know this is going to be a big benefit for people. You help clear some stuff up for me. And so I can have conversations with people in my life. So, and thank you for sharing your email as well so that people can reach out to you. And I'll put this in the comments so that way people have that.
Okay.
So thank you again,
welcome,
Dr. Felecia Froe. I can't wait to have another conversation with you someday.
I'll see you soon. Talk to you later. Okay.
Thank you. And thank you all for joining us today. We will see you again next weekend. Have a wonderful rest of your weekend. Take care.
Bye, everybody.